Syringomyelia is a disease in which there is development of cystic cavity in the spinal cord. Here is the MRI of a patient with syringomyelia. You can see a cavity in this section of spinal cord. This cavity is filled with CSF and progresses slowly, compressing other structures in the spinal cord. And symptoms of disease depend on the structures being compressed by this cavity. If we talk about causes of syringomyelia, there are congenital causes and acquired causes. Congenital causes include Chiari malformation, which is responsible for 60 to 70% cases of syringomyelia. On second, there is tethered cord syndrome. Acquired causes include trauma to spinal cord, cervicovertebral junction anomalies, bone tumors which compress the structures of spinal cord, meningitis, other infections of brain. Now we talk about the symptoms of syringomyelia. Loss of pain and temperature sensation in the upper part of the body is the most common and first symptom of syringomyelia. It is due to compression of spinothalamic tract. This sensory loss of pain and temperature is called cape-like or suspended sensory loss of Chiari. This picture explains the area of the body being involved and the Chiari derived from the armor. Headache can be the primary symptom of the disease if it is due to Chiari malformation. This disease usually involves the cervical area of the spinal cord. If the cystic cavity enlarges and compresses the anterior horn cells, then there is atrophy and paralysis of the upper part of the body. Hands are affected first and then upper extremities. This sensory loss is unilateral initially but bilateral when the cavity enlarges and the disease progresses in the time span of years. Now we move towards the posterior column symptoms. If the cavity involves the posterior column of the spinal cord, then there is position and vibration sensed which is lost. Stereognosis also is the main symptom of posterior column involvement. Another symptom is abnormal mobility of the joints. This was the whole story of symptoms. Now we move towards the investigations or labs of syringomyelia. When we talk about the investigations, MRI is the only best answer because it is the investigation of choice for syringomyelia. We advise magnetic resonance imaging of cervical spine, and each section of the MRI shows different parts of the different anatomical positions of the cervical spine. If there is any hyperdense area, any cystic cavity, any tumor or any mass, it is detected on the MRI. We have talked about investigations and we move towards the treatment of syringomyelia. Rule of treating this condition is treat the cause. When we establish a cause, we treat the cause and we treat syringomyelia. If the cystic cavity is small and the symptoms are mild or minimal, we just observe and medically manage the patient. And all this treatment is symptomatic. There is cutoff point of symptoms of the patient and the size of cavity, which decides now it is time to move towards a surgery or any decompression procedure. In most of the patients, the surgery is done when there is any neurological deficit or progressive enlargement of the cystic cavity in the serial imaging. If syringomyelia is due to cervicovertebral joint abnormalities and the symptoms are progressive, cavity is enlarging, we go towards the surgical procedure. These are the surgical procedures which we perform if there is any cervicovertebral junction anomaly. The options are ventriculoperitoneal shunt, cervical laminectomy, arachnoid adhesion release, dural bands, expansive duroplasty. These are the different procedures which we perform to decrease the pressure, decrease the size of the cavity or cut off the connection points from which the CSF is coming in the cavity. Now if the syringomyelia is primary or cause is located in the spinal cord and not related to the cervicovertebral area, then we have different options to treat this condition. The first option is syringostomy. The second option is creating a shunt between the cystic cavity and the subarachnoid space, and this is called shunting. The third option we have is endoscopic release of septations. The fourth one is terminal ventriculostomy. Now we move towards the outcome of surgery because all surgeries don't lead to complete cure of the patient or complete cure of the symptoms. The outcome of surgery is not 100% in each aspect. We will talk about aspects of pain, aspects of sensory sensation and aspects of motor improvement after surgery. Here are the numbers which show the percentage of success in different aspects of pain, sensory and motor improvement. There is a percentage of symptoms which can be improved after surgery. Sometimes the outcome of surgery is very fatal or aggressive, or the symptoms may worsen after surgery. So it depends on individual and So, neurosurgeons advise that this condition should be treated medically or conservatively unless and until there is progressive enlargement of the cystic cavity and symptoms are so aggressive that patient cannot deal with. So here is a story about syringomyelia. Subscribe to our channel for more updates. Thank you.